Hey, it's Dr. John with the Healthy MD, and today talking to you about coronavirus and kind of a lot of the questions that I'm getting from folks as far as what they need to do if they get diagnosed with COVID-19 or coronavirus, questions about vaccinations, do they need to retest, and just general questions about what this Delta variant is and what they need to know. So let's kind of start at the beginning. So obviously, COVID-19 coronavirus has been around since 2019, first diagnosed in Wuhan, China. Uh, Obviously, it's spread across the world, so pandemic, we've been dealing with this for the last 16, 17 months. Now what we're starting to see is different variants that come out. So the one that's been in the press the most lately is called Delta, or Delta variant. There's been an Alpha, there's been a Beta, there's been a Gamma, and there's going to be other variants as we kind of move forward. The Delta variant is the one that really has a lot of the doctors and scientists really concerned. Why is that? Well, if we compare the Delta variant of COVID-19 or coronavirus to the original coronavirus, the Delta variant's much more transmissible, which means it's easier to spread. And that's a concern because if we looked at the original coronavirus, each person who came down with coronavirus could spread it to maybe one or two people. And it really depends. There's some people who are super spreaders who could spread it to 15, 20, 30 people. And then some people wouldn't spread it to anybody. But on average, the original coronavirus or COVID-19, we'd see people spread it to one to two people. The Alpha variant, which came out of the UK or out of Great Britain, was about twice as transmissible as the original coronavirus. So instead of one to two people, two to four people. Delta variant, which came out of India back in December of 2020, is much more transmissible. So a transmission rate of where one person with the Delta variant can spread it to 5 to 6 to 7, maybe even 8 people. And then all those 5, 6, 7, or 8 people can then turn around and spread it to 5, 6, 7, or 8 people themselves. So you can see how quickly that would spread just in 2, 3, 4 passes of, of transmission. So the concern is that Delta variant's probably as transmissible as measles, which, believe it or not, is one of the more transmissible viruses out there. Why don't we see a lot of cases of measles? Vaccinations. So that's one of the things that really kind of think about, and that's why we're really concerned right now as we're seeing this uptick in cases, at least across the U.S., especially in places where vaccination rates are low, is that what's Delta variant going to do to folks, especially if you're not vaccinated? Um, One of the other questions I get is, hey, why did I get COVID-19 when I was vaccinated? And while I think we did a decent job as far as rolling out vaccinations in the US, and we're looking at, I think, almost 70% of a vaccination rate across the country, which is great, we didn't do a really good job of explaining what happens with the vaccine, or what are the benefits of the vaccine, and what are the limitations with the COVID-19 vaccine. So COVID-19 vaccines are really designed to keep you out of the hospital, keep you from dying, keep you from getting seriously ill. It is not a bulletproof and invisibility cloak that you can put on against COVID-19 though. It does prevent severity of illness because you already have antibodies to fight off the COVID-19 virus if you get infected with it, but it does not prevent you from getting COVID-19 in many cases. So the way analogy I use for folks is that think about this as being more of a like a seatbelt that you put on. So when you get in the car, you buckle up, you put on your seatbelt, but if you get in a car accident, you can still get injured, but hopefully not as badly as if you hadn't put the seatbelt on. So definitely seeing folks that have been vaccinated, fully vaccinated against COVID-19, still coming down with what looks to be the Delta variant. For the most part, at least the patients I'm talking with, they aren't that ill compared to the unvaccinated folks. Um, One of the other questions I got is, well, aren't vaccinated people getting the virus more often? And part of that comes out of a study that the CDC published in their morbidity and mortality report out of a cluster of cases that came out of Provincetown, Massachusetts, back in early July. And I think the numbers they looked at is that out of 400 or so people, if I have my numbers right, 74% of the positive cases were in vaccinated individuals. Massachusetts, however, has a vaccination rate sitting right around 70%. So on average, it's pretty much the numbers we would expect to see if you had the same number of people vaccinated versus unvaccinated going to Provincetown. More than likely, we had actually more vaccinated people out traveling and enjoying 4th of July weekend than the unvaccinated people who are probably staying at home. So probably a higher population of vaccinated folks being exposed to coronavirus. So again, there's still a possibility of getting COVID-19 even if you're vaccinated. So obviously, keep following your local and state Department of Health recommendations for whatever it is. If it's indoor masking, uh, definitely still social distance 6 feet. Try to stay in your bubble. If you have to travel, take precautions, things like that. So it's a lot of more common sense, I think, than anything else. You know, other questions I'm getting from folks is, okay, now that I have COVID-19, what do I do? Really depends on your symptoms. If you have mild to moderate symptoms, then you're going to isolate at home. And by that, I mean, if you just have fever, body aches, um, chills, kind of more like, quote, flu-like symptoms, I think you're fine to stay at home. Obviously, if you're having shortness of breath, difficulty breathing, chest pain, more severe symptoms, you want to be evaluated. And for that, I would actually go to the emergency department. They're really more set up to handle the more severe COVID cases, and people with severe COVID can get sick pretty quickly as well too. So if you're having those symptoms, obviously don't delay. If you do test positive for COVID, how long do you need to isolate? And the CDC guidelines currently are 10 days, and that's either 10 days from the start of your symptoms, being fever, chills, body aches, things like that, or from the date of your positive test, and actually the date that they performed the positive test, not the date that they actually um, give you your test results, because sometimes the PCR tests and that take a couple days to come back. So it's 10 days, and so the day you actually either had symptoms or tested would be day 0. So the following day would be day 1, then 2, then 3, then 4, then 5, then 6, and 7, and so on until day 10. The other part is you also need to be symptom free for the last 24 hours. So day 9 going into day 10, you need to be symptom free. That means no fever, no chills, things like that, and also off any medicines that may lower your fever. So no acetaminophen or Tylenol or Motrin or Advil or ibuprofen that would lower your temperature, and off all that. If you're symptom free and you're off all those medicines from day 9 into day 10, then you can come out of isolation. However, if you're still having symptoms, you still need to continue isolation until you're symptom free for 24 hours. And that can be, day 11, day 12, day 14. But at that point, you should definitely also be talking to your physician as well, too, if you're outside that window. Can you get, if you haven't been vaccinated and you've had COVID-19, should you get vaccinated? CDC is recommending that you do. How soon? Really depends. If you have mild, moderate symptoms and you did not receive any treatment as far as the monoclonal antibodies, you can usually get your vaccination right away. I usually tell folks wait about 2 to 4 weeks, depending on how you feel and how severe your symptoms were. If you're hospitalized in the ICU to receive the monoclonal antibodies, the current recommendation is to wait 90 days or 3 months to get your COVID vaccination. So I think that's one of the other things with that too. One of the other big questions getting folks is, do I need to retest after a positive COVID test? And right now, would not recommend retesting. And part of it is the way that the tests are designed. They're actually fairly accurate for looking for viral particles or pieces of the virus in your nasal passage, so in your nose and your mouth. As your immune system fights off the COVID-19 virus, there's going to be viral debris or pieces of the virus still left over in your nasal passage. So if we go and keep swabbing your nose, you're going to keep testing positive, even though you are no longer infectious because you don't have any more of the whole COVID virus to go ahead and infect people. So do not retest unless your doctor, for whatever reason, is telling you, hey, we need to retest you for this reason, for that reason. But it's not something where work should be telling you, hey, you need to get retested for a negative test. CDC is not recommending that, especially if you're asymptomatic or minimal symptoms. Trying to think of some of the other things. People are asking again about, how to treat it. And really, if it's mild symptoms, treat it, treat the symptoms. So if you have a fever, then Tylenol, Motrin, Advil. If you're having cough, then any of your over-the-counter cold medicines. If you're having difficulty breathing, if you're having that chest pain, shortness of breath, you really need to be evaluated in the ER for that type of those types of symptoms. And I think those are kind of the biggest questions I get. Probably post some more COVID-19 information here because I know a lot of people have been asking me about it. And one of the things that we're trying to help is get that information out. I know there's a lot of different misinformation is probably the polite way to put it out there. But again, this is really serious. It is deadly. You do need to take care of yourself. Really highly recommend you get vaccinated. But again, that's not a carte blanche to kind of go out and do whatever you want. So stay safe as well too. Even if you're vaccinated, you can get the virus. You can pass it on to folks who are unvaccinated, and then they can get sick and end up in the hospital and potentially fatal. So be safe out there. This is Dr. John Martinez with the Healthy MD coming to you with another Healthy MD tip. Take care. Hey, Dr. John again from the Healthy MD. Hey, just want to give a shout out to everyone who's been following the YouTube videos and ask you two favors. One is to hit the like button down below. And number two is also subscribe to the channel. That way you'll know when we get new videos out and you'll be the most up to date on all the information coming out. So again, thanks all for all your support. Look forward to putting out some more videos for you guys over the next couple of weeks and take care.